Going back into the 1950s, as you read the history of the VA, what you'll find is a time frame where employees used to show up at headquarters and they wore uniforms. When they came in at 8 o'clock in the morning, they used to shut the gates to the VA, to the entrance, and you were not allowed to enter the VA facility unless they called up to the secretary's office. And you can imagine times have changed dramatically, not only in terms of the working environment, but also in terms of information technology. In the 1950s, the VA was actually an organization that bought the second commercial computer system ever developed or sold by IBM. The VA got into the first generation of computer systems in the 1955-56 time frame, and the technology we're talking about in the 50s were things like huge mainframes, punch card systems. There were no CRTs and PCs that we use today. In fact, in the 1950s, that's when we actually started to use telephones, and the telegraph system was greatly expanded, and that was one of the ways that we communicated back and forth between the facilities across the country. We had technology like pneumatic tube systems that were introduced into VA medical centers to move information around. We also started to advance and use technology like microphotography, microfilm. That was the state of the art way back in the 1950s. The use of computers in healthcare was minimal. The VA basically in the 1950s was feeling its way forward, as was every organization in the world, trying to figure out what the heck do you use computers for. They were good for number crunching, but what else? In the 1960s, the VA had finished with its experimental phase and committed itself fully to moving forward with automated data processing, ADP systems, computers, and telecommunications. The Veterans Administration actually created the Department of Data Management in 1963, which was placed on par with the Department of Veterans Benefits and the Department of Medicine and Surgery. It was that important to the VA to start using computers. In 1965, the VA actually put together its first long-range ADP, or computer planning documents, and started to move forward step by step in its long journey to automate the organization. The types of technology we were using back then were second generation, very large-scale computer systems, some medium-sized, the type of computers where, that would fill up a huge room and contained all of the computing power of a laptop of today. The VA actually built 6 large data computing centers, data processing centers located across the country. And the types of applications that were automated way back then were primarily the financial and logistical systems, the accounting, payroll, supply. Those were the types of things that not only in the VA but across the country people were starting to use computers to help automate. Electronic accounting machines, which had been around in the 1950s, were phased out, and punch card systems were the dominant way of interacting with a computer system, although we did start to see the first introduction of computer terminals, cathode ray tubes, CRTs. And in the area of healthcare, the first applications were built in the VA. The patient treatment file, which is a national database that records all of the events, episodes of treatment by patients, was created and was housed down at the Austin Data Processing Center. And The Automated Hospital Information System, known as AHIS, was created and deployed at the Washington VA Medical Center. This was actually the first ever hospital information system in the world. The VA actually has been a leader in so many areas, and this was one area that once again we stepped out in front of everyone else. Other technologies, information technologies introduced back in the 1960s were facsimile machines. In the hospital environment, nurse call machines, hospital paging, dictation equipment, closed circuit TV, and again, microfilm and teletype. The use of that technology was expanded. The ADP environment in the 1970s, we made a big leap forward. We moved into the third generation computer systems. They were more powerful, a little smaller in scale, and we actually started to move some of these out of the national data processing centers and started housing them in a handful of VA medical centers. The VA in the 1970s tended to focus its efforts to automate business practices on the veterans benefit side of the house. That was the decade when the target system came into being. The automation of the education system, the veterans benefits, the housing program, the insurance program, and the BURL system, the beneficiary identification and record locator system, sort of a national database of all veterans, was created, and that too was housed at the Austin Data Processing Center. The Engineering Management Information System was created, a system used at all of the VA medical centers. And in the healthcare environment in particular, we saw the emergence of the acquisition and emergence of Honeywell clinical laboratory systems. They were referred to as ClinLab, and they were installed at about 10 VA medical centers in the country. Very rudimentary versions of what we use today. They had patient registration, clinic scheduling, and pharmacy and lab. That was about it. We also, in the 1970s, developed the Apple system, the Automated Prescription Processing, Labeling, Editing, and Storage System. In other words, the pharmacy system. This was the forerunner to the pharmacy system as it now exists within the larger Vista system. We also developed the fee basis system, an outpatient treatment file, and a lot of standalone applications as we learned how to use computers to help us automate the healthcare business side of the house. The VA also started to introduce and use some cutting-edge technology back then. We actually implemented the database management system in the target system. We used database management systems pretty much before most people in the country ever used them. And from our use of that, we saw a lot of airline companies and other organizations then follow suit. And we also moved into a distributed data processing environment. We started to link the computer systems around the country together. And the use of CRTs certainly spread, and we saw tens of thousands of those start to roll into the VA. Some of the other technologies that emerged in the 1970s included things like Pbx Systems, the automated sort of semi-computerized telephone systems that were installed in hospitals. Word processing systems came into being. And we started to do more and more point-to-point data networking, hooking up the large data processing centers over the first data networks that were fairly slow speed.